You're watching Cetome TV. Knowledge is power.
So inherited testing, the most common, poster child mutations for this are referred to as the BRCA1 and 2. And so these are classic tumor suppressor genes. And so certain mutations can occur in these genes. They're tumor suppressors. If they see that there's a lot of DNA damage in the cell, they will stop that cell and they will cause apoptosis and prevent that cell from growing and producing more, daughter cells. So they're very important. We've got quite a few different tumor suppressor genes. BRCA1 and 2 are just, two of them. But the important thing about inherited testing is it tells us whether these pathways are deficient and whether you have an increased sensitivity to certain carcinogens. So if you have a BRCA1 and 2 mutation and it's inherited, passed on from your parents, that does not mean you're going to get cancer. It means you have a higher risk of getting cancer if you're exposed to carcinogens. So it's very important to get this. If you have one of these tests and you find out you have this BRCA1 or 2 mutation, then you can change your lifestyle. You can eat, a healthier diet. You can avoid smoking. You can have, a few extra drinks less at the party than you normally would if you didn't know you had these mutations. You could live your life differently and then probably have the same risk factor of cancer as somebody who didn't have these mutations. So they allow us to consciously make daily decisions. This knowledge allows us to make these consciously daily decisions that can have a great impact on how we develop different diseases, including cancers. So typically, if we see a cancer in a person that is under 50 years old, this is called the Amsterdam criteria, or part of the Amsterdam criteria. If we see a patient that is under 50 years old with a cancer, then we assume that they have a mutation in a tumor suppressor like BRCA1 or 2 that increases their risk. So we like to do inherited testing too. But more importantly, it allows us to say, well, sure, you missed this. You don't, you have cancer now because you have this mutation, but you have kids. So let's test your kids. And if they have the mutation, then we can take the steps like monitoring them, getting, extra scans, maybe getting an MRI every few years when they're young adults, and watching instead of just ignoring it. We can watch and catch the cancer at a very early stage, and we can also teach them about the benefits of living a healthy lifestyle with their mutations. So knowledge is power, and inherited mutational testing is the power there.
Thank you for watching Cetome TV. Subscribe below and stay informed.